This is our group presentation for Biology 2402, Mr. Jason Langford's class at Angelina College. We are over hypertension and stroke. Presentation is by Tanya, Desiree, and Lori. Obesity has reached epidemic proportions in the Western world, bringing with it a surge in hypertension. Having high blood pressure raises your risk for heart disease and stroke. With stroke and heart disease being the leading cause of death, education on hypertension, stroke, and prevention of hypertension is needed. Hypertension. What is hypertension? Blood pressure is a reading received on the amount of pressure in the heart's arteries while the heart is beating and at rest between beats. Primary hypertension occurs over years, while secondary hypertension occurs due to an underlying condition such as health problems, medications, or illegal drugs. Hypertension signs and symptoms. Know your numbers. In order to diagnose with hypertension, a doctor may ask a patient to keep a log of blood pressure readings or ask a patient to come into the office at different times and days to see the average of the patient's blood pressure. Blood pressure levels. The optimal blood pressure for most people is 120/80. Hypertension is 140 or higher or 90 or higher. Other risks that are age, race, genetics, obesity, lack of physical activity, tobacco, and increase in sodium. Also, a decrease of potassium and vitamin D, alcohol, stress, and other health conditions. As you can see, since 1979, more women than men are being affected by hypertension. After being diagnosed with hypertension, doctors may ask patients to change lifestyles. Lifestyle changes may not be enough to control hypertension, so the doctor may manage the patient's blood pressure with medicines like diuretics, beta blockers, ACE inhibitors, ARBs, calcium channel blockers, and renin inhibitors.
Hypertension does most of its damage by gradually injuring the arteries and organs of the body. Weakened blood vessels can break open or develop cholesterol-laden deposits that rupture, leading to blockages of the artery. When a blood vessel ruptures or becomes blocked in the brain, part of the brain that is supplied by the blood vessel dies. This event is called a stroke. The signs and symptoms. A stroke is caused by an interruption in the supply of blood to a portion of the brain. The interruption is caused by a blockage or by loss because of bleeding. A blood clot that forms somewhere in the body and travels to the brain and lodges in a blood vessel, preventing the flow of blood to a part of the brain. Cholesterol builds up on the inner wall of the artery to the brain, causing narrowing, hardening, or weakening. Stroke. It includes a loss of consciousness, loss of sensation, loss of involuntary movement. A TIA can last for a few seconds or hours, may come and go for days. Alright, now the left versus the right. If you have a stroke that occurs in the right hemisphere, it will affect the left side of the body, your language, and number skills. If you have one that occurs on the left side, it will affect the right side of your body, music, and creativity. Stroke. Hemophilia is where you cannot move a certain side of the body, and hemophoresis, it causes weakness to a certain side of the body. Medication started after stroke diagnosis. TPA, tissue plasminogen activator. It's a protein involved in the breakdown of blood clots. TPA given within 6 hours of a stroke significantly increased the odds of being alive, particularly in patients treated within 3 hours. Blood thinners. We have antiplatelet medications, Plavix, Lovenox, and aspirin. Anticoagulant medicines, Coumadin, heparin, SQ or IV. blood pressures, ACE, ARBs, beta blockers, calcium channel blockers, diuretics.
Stroke testing. NJH stroke scale. Some of the testing when stroke is suspected is TJH stroke scale, CT, and blood. Blood work is PTT, PT, INR, CBC, cholesterol. CT results are bleed in the brain. Other tests to be ran on patients include the EKG, carotid ultrasound, echo, CT angiogram, and carotid angiography. FAST, an acronym for the public and health professionals that help to remember signs of stroke. This test is done on every patient who exhibits stroke symptoms. F, facial weakness, A for arm weakness, S for speech problems, T for time to call 911. FAST, have the person smile. Is it uneven? Check grips in each arm. Have patient push away from your hand with their arm. The word salad. Is one side weaker than the other side? And slurred speech. This is the form many hospitals use to track patient through hospital stays. H, stroke scale. Mama, tip top, 50-50, thanks, huckleberry, baseball player. These are goals for the treatment when the patient first arrives into the emergency room until the time they get into a bed and that the test results are done. Hospital protocols. Most hospitals have a time frame on when a patient first walks through the emergency room. The patient is put into a hospital bed. Tests performed, labs drawn, doctor notified, and medications given.
After a stroke. Some changes in life after a stroke include medication changes, rehab, lifestyle changes that include diet and exercise. Rehab processes involve 6 major focuses. Let's see. Number 1, you have preventing, recognizing, and managing. Then you have maximum independence. Number 2. Number 3, coping and adaptation by patient and family. Number 4, preventing secondary. Number 5, enhancing quality of life. Number 6, preventing second stroke and other vascular conditions such as MI that increase with the stroke. Places where rehab can be accomplished are nursing homes and your home. In the nursing home, you'll be able to get physical therapy, occupational therapy, speech, nurse, a psychiatrist, vocational rehabilitation. And at your home, you can get home health and outpatient. Discharge after a stroke. The patient has 50% of recovery when sent home versus less than 10% when sent to hospice. Rehab does not reverse the effects of stroke. The goal is to recover as much as possible. Most of the recovery for a stroke patient happens within the first weeks to months. Stroke recovery can be slow, and the process is sometimes lifelong.
Prevention for future strokes. Medication. ACE, ARBs, beta blockers, calcium channel blockers, and diuretics are some of the medications that you will receive. Cholesterol-lowering medications are cholesterol absorption inhibitors, fibric acid diuretics, niacin, resin, statins, Crestor, Lipitor. Also diet. Reduce fat and trans fat, reduce sodium intake, increase potassium, increase magnesium, increase calcium, reduce alcohol intake, and stop smoking. Exercise as well. Aerobic exercise, 30 to 45 minute walk, 3 to 5 times per week, and weight loss. Mental health, quality sleep, relaxation techniques, and active social lifestyle.